I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor. In this video, I'm going to show you a 10-minute balance exercises for seniors that I would highly recommend to do it every day. So I do see a lot of seniors in my practice. The most unfortunate thing that can happen to seniors is basically falls that can completely change one's life. So you might ask me, why is there an increased risk for falls as we grow older? So the first reason is that we start to lose muscle strength and muscle mass as we grow older. However, by engaging strength training exercises at least 2 to 3 times per week, we can slow down the loss of muscle strength and muscle mass and thereby preventing the risk for falls. So we're highly engaged to do strength training 2 to 3 times per week, where you focus on mimicking the functional movements that you do every day. So basically squatting, hinge exercises, and focusing on like push and pull exercises for upper body. So the next thing is that we start to lose our proprioception. So when we say proprioception, it's basically the awareness or basically the mind joint muscle connection, thereby you know where the joint is in space. So for example, like let's say if someone pushes me, so you want to make sure that you activate the right muscles at the right time. You want to make sure that the joint is in the right position and thereby preventing a fall from happening. So let us say if there's any impairment of those things, then a fall can happen, which is why I advise you to engage in balance exercises pretty much every day. So the next thing is polypharmacy. So as we grow older, we start to develop a lot of chronic diseases, thereby leading to increased pill burden. So the most important thing is that if you're on more than 5 medications, I highly recommend to discuss with your healthcare provider to see if those pills can cause side effects and thereby increase the risk for falls. And the other thing is that unsafe environment. So as we grow older, we want to make sure that our environment is safe so that we don't trip over and cause a risk for falls. Okay. So now without further ado, let's get started with our balance exercises. So if you're someone who had a fall history or basically you feel unsteady while walking, then I would hire a knowledgeable physical therapist and do the balance exercises under their supervision. Sometimes these balance exercises can actually pose a safety risk if you have an increased risk for falls. So this is a little bit of a challenging balance exercises for seniors who are pretty active and have not had any history of falls or any kind of like unsteadiness while walking. So without further ado, let's get started. So the first exercise is going to be closed stance exercise. So here you're going to bring both legs closer to you. So this is going to create some unsteadiness in your balance, and you're going to bring your hands onto your hips, and then I'm going to put a timer for 30 seconds here, and you're going to hold this balance for 30 seconds straight. So in order to enhance the challenge, you can close your eyes, and now you're going to focus on holding your balance for 30 seconds straight. So again, it is not challenging for me right now, but it is definitely going to be challenging for seniors as we do it. Again, there are some people who have a really good balance, better than me, and they probably might find this exercise easier. But again, focus on improving the balance. If you feel unsteady, that's probably, it's a good thing because you're actually focusing on improving that unsteadiness. So you can always have a chair just in front of you, just to make sure that if you lose balance, you always have a chair to grab onto. So the next exercise is going to be single leg balance. You're going to bend your knee like this on one leg, and you're going to stand on one leg here, and you're going to keep your hands on your hips like this, and you're going to hold this balance for 30 seconds straight. So again, this can be challenging. Again, have a chair or something like that here so that you can have something for support. Otherwise, you're going to hold this balance, and if you feel like this is easier, then close your eyes. And again, as soon as I close my eyes, I feel it really challenging right now. But again, this is something that you go by step progression from standing with eyes open and then standing with eyes closed. Now we're going to repeat on the other leg here. So again, we're going to put a timer for 30 seconds straight here, and you're going to hold this single leg balance for 30 seconds straight. So I've had multiple ankle sprains in the past, and I probably feel like I'm a little bit unsteady on one ankle compared to the other. But again, as I feel this is more easier, then you can always close your eyes and then to increase the challenge of the balance exercise. Okay, so you're going to hold this single leg balance for 30 seconds straight, and you're strengthening your balance here. Okay, so the next exercise is going to be tandem stance. So basically you're going to bring your one leg in the front and it's going to be almost closer like this here, and then hands on your hips here, and again I'm going to put a timer for 30 seconds straight, and you're going to hold this tandem stance for 30 seconds. So to show you here, same like here, again keep holding that tandem stance, and this time you can close your eyes to increase the balance. Again, make sure that you have a chair or something like that right in front of you to have some support if you need it. Again, keep your eyes open if you feel that is challenging. If keeping your eyes open is not challenging, then close your eyes like this. And you're going to hold this balance for 30 seconds straight here. Okay. Now we're going to repeat on the other leg. So basically now the right leg goes behind and the left leg comes in the front, and you're going to hands on your hips, and then you're going to hold this tandem stance for 30 seconds straight. Again, to enhance the challenge or to increase the challenge, you're going to close your eyes. And as soon as I close my eyes, I feel like very unsteady right now, and that's a good thing because I know that I need to keep improving my balance too. But again, focus on breathing, and again make sure that you have like a chair or something like for support, so that you can have something for support if you lose your balance. Okay. So the next exercise is basically kind of like regain balance as you step to one leg. So sometimes when we fall, so you're stepping onto one foot, but then as you try to step onto that foot, you want to make sure that you can actually prevent from falling. So we're going to train that same. So here you're going to and we're going to make a timer for 30 seconds. So we're going to bring one leg and then one side. So that's 1, and then 2, and then 3, and then 4, and then 5, and then 6, and then 7, and then 8, and then 9, and then 10, and then 11, 12. But again, we're doing this for 30 seconds straight. So how many reps that you can get it done, and again you're trying to hold that balance so that you're not like going backwards. So again, have a chair or something like that, so you can put a chair in front and you can do the same thing here. Okay. So the last two exercises is going to be more like a reactive balance training exercise. So here we're going to do it all alone. So we're going to face a wall like this, and what we're trying to do is that we're trying to simulate a fall, and then we're going to prevent that fall from happening. So you're going to go all the way close to the floor, so close to the wall, and then you're going to prevent that from happening. So you can have your hands, so just in case if you miss it, you still have hands for support. So again, you're going all the way close, and then you're going to come back. Okay. So let's do this for 30 seconds straight. Okay, ready? 1, 2, 3, go. So again, I'm going close to the wall, close to the wall, close to the wall, and then I'm preventing that fall. That's 1. Again, close to the wall, close to the wall, close to the wall, and then I'm preventing a fall. Again, close to the wall, close to the wall, close to the wall, and I'm preventing a fall. So you're going to do this for 30 seconds straight. So that's good. And then close to the wall, close to the wall, close to the wall, and then I'm bringing it. So you're contracting your core, you're contracting your hip muscles, you're contracting your glutes in order to prevent this fall from happening. Okay. Good. So again, close, 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 close. So if you find this kind of pretty challenging, you can always come closer to you and then start from here, and then slowly you just kind of like go backwards as you start to become more. So now that we completed the forward perturbation, now we're going to do the side perturbation. So basically here, you're going to bring your leg closer, and then you're trying to go towards the wall, but then you're trying not to go all the way, and then you're trying to bring back your balance. So let's start with the timer for 30 seconds straight here. So kind of going to go all the way to the close to the wall and then come back. So again, all the way close to the wall and then come back. All the way close to the wall and then come back. So it's okay to touch the wall, but again, you're not putting your whole weight like this, but rather you're just going to go all the way and then touch it and then come back. So all the way, all the way, all the way, all the way, touch it and then come back. All the way, all the way, all the way, all the way, touch it and then come back. So this way you can see your core contracting to prevent that fall from happening, and you're actually enhancing your core strength here. Okay. So now as we did the left side, now we're going to do the right side. So I'm going to face my back towards the camera here. I'm going to hold the timer for 30 seconds straight, and then we're going to do the same. So we're going to almost touch the wall and then come back. So right now I'm probably going to have to move closer to the wall here. So 1, good. So again, close the wall, close the wall, close the wall, and then come back. So I would probably need a little bit more challenge. So I'm going to come away from the wall a little bit more, and then go all the way, and then come back. So again, all the way, all the way, all the way, all the way, and then come back. All the way, 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 and then come back. Again, all the way, 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 and then come back. Again, one more time, I think so. All the way, all the way, all the way, and then come back. Okay. So again, if something happens, you're still like here. But again, the goal is not to put the weight, but rather just kind of like shift the weight and then come back. Okay, good. Great, that's it guys. I hope this video was helpful. If you really like this video, if you found this video helpful, please make sure to hit the like button. And if you want to watch more content like this, please make sure to hit the subscribe button. If you're someone who's looking for a home stretching, like a 10-minute static stretching routine, that you can do pretty much every day, then I would recommend to check out this video here. If you're looking for home strength training exercises, then I recommend checking out this playlist here. And I'll see you in my next video. Until then, goodbye.